Let's talk about visual expectations when you have advanced glaucoma. I'll have this situation come up where a patient may be 20/20 or have great vision on the eye chart, but they're frustrated by that because they feel like the quality of their vision is very poor. And when you get to the advanced stages of glaucoma, there's three things in particular that as of now, we don't really have a way to undo, that you really have to work around and navigate rather than something we can simply fix. One, there's a loss of color. So colors just don't look as vivid or as bright as they used to, even with cataract surgery. They look a little more washed out. Two, contrast takes a hit. So contrast sensitivity, which is important when you're reading. You need kind of brighter whites next to darker darks to get that contrast to be able to read things well. And that's something that is adjustable. So on your phone or on your computer or tablet, you can play with the contrast on the screen, as well as the font size, of course, to try to help you see things better and use the vision you have more effectively. And then three would be light dark adaptation. So when you're going from a dark environment to a bright environment and vice versa, it takes you a lot longer to adapt than you used to. And this could actually play out. I had a patient describe driving and going into a dark tunnel where that really throws him, because he kind of shocks him and he can't see well with that immediate change in light. So obviously, if you're choosing to drive in that setting, you have to be very careful and cautious about that in situations where there's bright lights and shadows back to back with each other. But otherwise, this is more just knowing that it's going to take a longer adjustment when you go from indoors to outdoors and depending on what the context is. So again, color takes a hit, contrast takes a hit, and then it takes longer to adapt to changes in light. So expect those three things with advanced glaucoma. The last thing I'll mention, and this is a minority, but it does come up often enough, when you have a lot of visual field loss from glaucoma, sometimes patients will drift into small amounts of double vision, whether side to side or up and down, that appear when they're really tired or they've been reading for a long time. You don't have to remember the name of this condition, but just the basics are that your brainstem is involuntarily, without you thinking, holding the two images from each of your eyes together as you move your eyes all around space. It's one of the most fascinating systems in the body. And if there's chunks of the vision that are missing from glaucoma, there's less information for your brainstem to kind of hold together. And with age and trauma and then stuff like, glaucoma defects, this can increase the chance that when you get tired, one of the eyes tends to drift a little bit and cause you to be double. And usually you can kind of blink a few times and snap out of it. If it happens most of the time or at an increased frequency, there's special pairs of glasses that can help with this. If it's ever a sudden double vision and you're not able to move one of your eyes properly, that is different. And that needs to be evaluated promptly, and you need to call us that same day. But what I'm describing is a very subtle drift that is relatively short and happens more when you're fatigued. That is something that can also come up and be more likely in the advanced stages of glaucoma. So hopefully you found this video informative and we can discuss further at our next visit.